Thank you. Can we hear it for Sal Rosselli? You know, I've been around politics for a long time, and I have watched Sal for a very, very long time, and there is no harder fighter than Sal Rosselli. He will never, ever give up. So Sal, thank you for everything you do. You know, and I want to thank you. First of all, thank you for saving lives and being there for our community day in and day out. But thank you also because you're on strike, and of course it's about the contract. But you're not just on strike about the contract. You are striking because you care like hell about the people that you serve and their health. And there are plenty of strikes that are about increasing pay and health care and benefits and all that, and that's really important. But you're not just demanding that. You are demanding that your patients be treated better. And I thank you for that. You know, I am so sick of behavioral health being treated as something in the back seat, an afterthought. For so many years, for decades, for forever, it's been like mental health is just like, just suck it up, just be stronger, just get over it, just be tough, as if it were just like some sort of personal failing. And we know that, I mean, there's not even a debate. Mental health is no different than physical health. It is the same. And we would never, if someone showed up and said, I have a broken arm, would we ever let them say, oh, come back and we'll give you an appointment in 3 months for that? Would we ever let them say, oh, you have a broken arm, come back when it's infected, it's not bad enough yet? We would never let that happen, and yet that is exactly what we've been letting happen with behavioral health here at Kaiser and in this country, and it has to stop. It has to stop. And, you know, Sal talked about these bills that we all worked on together, our mental health parity law, SB 855, the timely access law, SB 221, and those were big fights. The vote tallies in the end were off the chart, bipartisan, overwhelming support, because when you put it up for a vote at the end, members of the legislature, bipartisan, get it. But they were both huge fights with Kaiser and with the other health plans to get there. But together, in coalition, we got it done, and I am so proud of that coalition. And NUHW played such a huge role in getting both of those bills done. But now we have to enforce them. And I've learned over time, it's wonderful as a legislator when you're authoring a law and you see those votes go up with the tally and the governor signs it, and it's like exhilarating to pass a big law. It makes you feel so good. But I've learned over time it's just step one. Because if you don't pay attention to the enforcement and implementation afterwards, it's just a pretty piece of paper with the governor's signature on it. And I like pretty pieces of paper with the governor's signature, but it's not enough. And so we are holding the health plans accountable, and we're holding our agencies accountable to enforce this law and make sure it has meaning for people's lives and people get the health care they need and that they can survive and thrive, because that's what it's about in the end. It is frustrating to me, and I know to all of you, you know, in SB 221, it's a pretty basic thing to say if someone needs an appointment within 2 weeks, you got to give them an appointment within 2 weeks. We even gave them an extra 6 months to comply. It should have gone into effect January 1st. We gave it till July 1st to say, let's give them some extra space to comply. Kaiser is not complying with SB 221. And it's time to come into compliance. It's time to make sure people have access to care. That's what this strike is about, and I am here with you in complete and utter solidarity. So let's keep fighting. Thank you.